C. Aitona from BSN1 11G, and today I will be performing a oral administration of medication return demonstration. So oral administration is the most common, least expensive, and most convenient route of administration for patients. In doing so, it is essential to remember and adhere to 10 rights of medication administration to avoid errors and ensure client safety and well-being. So the 10 rights of medication administration include the right patient, right medication, right dosage, right time, right route, right client education, right documentation, right to refuse, right assessment, and right evaluation. So before conducting the procedure, the first thing to do is to check the physician's order to know what medication should be given to the assigned patient. So know the reason why the client is receiving the medication. So the patient need to take vitamin C for wound healing. It is needed for many functions in the body, including helping the body use carbohydrates, fats, and protein. Vitamin C also strengthens blood vessels walls. Check the medication administration record, or MAR, with the physician's order. So check for the drug name, dosage, frequency, route of administration, and expiration date for administering the medication. So verify the client's ability to take medication orally. Determines whether the client can swallow, is NPO, or nauseated or vomiting, has gastric suction, or has diminished or absent bowel sound. Then perform hand hygiene to deter the spread of microorganisms. So now arrange and organize medication tray and cups in preparation area, including medication tickets. If not using a MAR. Now organize the supplies and bring the requisites to the preparation area. The requisites include a medicine cup, medicine tray, and if it needed, stethoscope and sphygmomanometer, and also prepare the medication for one patient at a time. Obtain the correct drug, compare name of the medication on label with EMAR or medication ticket, and exit ADS after removing drugs. Then check or calculate drug dose as necessary. Then double check calculation, check expiration date on all medication, and return outdated medication to pharmacy. If there are any, check record for medication count and compare current count with supply available, especially if preparing a controlled substance. So now read the MAR and take the appropriate medicine. Then compare the label of the medication against the order on the MAR or computer printout. Now recheck the medicine label with a MAR and also note for expiration date. So, places package unit dose, capsules, or tablets directly into the medicine cup. Do not remove the medication from the package until at the bedside. Required number into the bottle cup and then transfer the medication to disposable cup without touching the tablets. If using a stock container, pour the required number into the bottle cup, then transfer the medication to disposable cup without touching the tablets. Breaks only scored tablets if necessary to obtain the correct dosage. Use a cutting or splinting device if needed. If the client has difficulty swallowing, check if the medication can be crushed. If it's acceptable, crush the tablets to a fine powder with all peel crusher. places the prepared medication and MAR together on the medication cart. Recheck the label of the container before turning the bottle box or envelope to its storage place. Avoid leaving prepared medication unattended. Then lock the medication cart before entering the client's room. So now check the room number against the MAR if agency policy does not allow the MAR to be removed from the medication cart. Now place the prepared medication and MAR on the same cart and check the room number against the MAR before entering the client's room. Then I will introduce myself and verify the client's identity using agency protocol.
Come in.
So, good day, ma'am. I'm Kate NC Alcona, your student nurse for today. So, may I see your wristband, please? So, please state your name and your birthday, please.
I'm Sharon Lee Ibarra. My birthday is May 9, 2004.
Okay, thank you. So provide the client's privacy. So, prior to conduct for the procedure, I'm going to close the door, then adjust the curtains to ensure the client's privacy and educate the clients and client's family of the medication to be taken, its purpose, route of the to discuss the purpose of the medication. So okay, ma'am, so Dr. Peralta has prescribed you with a vitamin C and it is generic. It's a ascorbic acid to be taken 3 times a day, so after meals, and it is a tablet form, which means you'll have to take it orally. Then, so is that okay with you?
Yes po.
So vitamin C is necessary for wound healing. It is needed for many functions in the body, including helping the body use carbohydrates, fats, and proteins. So vitamin C also strengthens blood vessels walls. Too much, it can cause side effects such as nausea, vomiting, headache, insomnia, and more. So okay, ma'am, can you sit po here? Assist the client to a sitting position, or if not possible, to a side-lying position, which is I already did. Then okay, ma'am, so are you comfortable with your seats?
Yes.
Okay, so if not previously assessed, take the required assessment measure such as PR, RR, BP. If needed, perform the pre-administration assessment such as taking blood pressure, pulse rate, and respiration rate. Okay, ma'am, before I give you your medicine, I'm going to check first your blood pressure. Pwede ba idungan, di ba? Sige, kawala. Your blood pressure is 120/80. Okay. So now I'll compare the names of the medication and labels with the medication tickets at client's bedside. If using the EMAR, scan the client's barcode to verify the administration of medication. So compare the names of medication and the labels with the medication tickets at client's bedside. If using the MAR, to verify the administration of medication. So pick up video medication and compare the labels with barcode on the drug and EMAR. So, administer the medication at the correct time. Takes the medication to the client within the guidelines of the agency. So, ma'am, you will take your vitamins right now since you are done eating your breakfast. Then, give the client sufficient water or prefer juice to swallow the medication. And if the client is unable to hold the pill cup, use the pill cup to introduce the medication into the client's mouth and give only one tablet or capsule at a time. So, if an older child or adult has difficulty swallowing, ask the client to place the medication in the back of the tongue before taking the water. If the medication has a objectionable taste, ask the client to suck a few ice chips before or give the medication with juice, applesauce, or pudding if there are no contradictions. If the client says that the medication you are about to give is different from the client has been receiving, do not give the medication without checking the original order. Then stays with the client until all the medication have been swallowed. So, okay ma'am, very good. Now that you are done taking your medicine, now I'm going to leave. Then then you can have your rest. But do you need anything before I leave?
Ma'am.
So, okay ma'am, I'll come back after a few minutes to check on you. Then thank you very much for your cooperation. Then the document in each medication given. Now I'm done with administering the medication to my patient. I will proceed to the documentation process of the procedure I have just done. So, record the medication given, dosage, time, and complaints of the assessment of the client, and your signature. The documentation would include the medication route, type, and time it was given. So, I have given my patient a vitamin C as per the doctor's order. The vitamins generic name is ascorbic acid to be taken 3 times a day after meals. If medication was refused or omitted, record the fact on the appropriate record, document the reason when possible, and the nurse action according to agency policy. Now also include the documentation any complaint from the patient in the documentation, and if the medication has been refused or omitted, then also document the reason for a omission. Lastly, always remember to fix your signature to the documentation sheet and indicating that you have carried out the doctor's order. So disposes all the supplies appropriately, replenishes stock, and return the cart to the appropriate place and discard used disposable supplies. And that would be all. Thank you.